I'm supporting countries and our global engagement around integrated service delivery for children in an environment that is rapidly changing, where we want to maintain a focus on making sure that children survive, but at the same time that they have a chance to thrive and develop in the SDG era. So we do a lot of thinking around integrating services, building on the frameworks that we already have, integrated community case management, integrated management of childhood illnesses, and the successes that we've had in building these, but also the clear gaps that were identified in a big review 2 years ago, and that really come up in every country, and those challenges are about health systems and the of human resources and the lack of counseling and supporting health workers in doing the work they do, and one other problem is the verticalization of programs and initiatives that function in silos somewhat at the national level, with often very good reason for why there needs to be a strong focus on one thing from my perspective, but all of these initiatives target the same frontline health workers. And how do we develop approaches and tools and guidance in a way that enables that frontline health worker to do his or her work efficiently and with quality, and to cover the essential interventions and counseling and advice to mothers, caregivers, and children that they need to get. And that depends very much on the context where they live, on the diseases that are prevalent, etc. So I think at this workshop, we're trying to strengthen nutrition interventions within health systems, and yet we're talking about, often, again, individual packages for a certain intervention that we want to be delivered within the health context. And I guess I'm on a mission to challenge people to think about what are the real important key components that can be integrated, and what to start not from the condition or the disease or the topic that we want to address, but to start from the child and look at the life cycle and look at what is it that the child needs at a certain time in its life when it interacts with the health system. And for young children up to 2 years, a lot of those routine interactions for healthy children, they are determined by, for the pregnant mother, the ANC schedule, and then for the child, the immunization schedule. And there are many missed opportunities to link specifically guidance and advice, but also to pick up children that don't grow well, or possibly mothers that are struggling with feeding their children, or households that are vulnerable and therefore cannot support their children the way they should. So how can we make use of that and really be more comprehensive? And then obviously how can we think about what needs to happen when children are sick and seek services, and how can we improve advice around nutrition? What are services that we need to deliver to children that are vulnerable, such as low birth rate newborns, that are going to need special supports, but also the mothers are going to need special support because they are going to be overwhelmed and stressed, and to help these vulnerable newborns.